Here in Deba, Gombe State, the fight against tuberculosis is a daily reality. This story reveals the critical gaps in the system and the human toll when essential health services simply cannot reach everyone who needs them.
So tuberculosis is an infectious disease that is caused by Mycobacterium tuberculosis that affects the lungs, but usually it can invade other organs like the gastrointestinal tract, the kidneys, the lymph nodes, and the brain too. It can affect other organs. So it's not only the lungs it affects.
We have been on TB for long, but the rate at which we are finding its positive samples now is very, very alarming. Why we cannot tell? But on our own part, we are always doing the needful. First and foremost, we control our reagents to know if they are in order. We always make sure that we confirm if the machine is in order. So we are very, very confident that with what we are doing, all we are getting is real results. And in fact, the results are alarming.
But patients face two major hurdles. Medicine supply is uncertain, it can run out.
Matsalolin muke samu shine wani lokaci muna samu karancin magani. Saboda ana buƙatan a ce kowane mutum a ɗora shi a kit na maganinsa. Da wani lokaci in babu magani a ƙasa sai mu yi amfani da wani dabara kafin a ƙaro wani magani. Ana cikin aiki sai mu sami irin TB detection kit na TB lab ya ƙare. Kaga aiki zai tsaya.
And the communication link is broken.
Na biyu kuma wani lokaci idan muka sami patient positive ya kamata a sai a ɗora shi a magani. Da wani patient kafin ya samo shi yana jima tun da an fita kamar outreach, mutane sun taru, wancan ya zo wancan kauye, wancan ya zo an taru. To in ba ki address traceable ba, musamman wani bai da waya kuma baka traceable address ba, to shi ma sai ga mun lose wannan patient. Gashi an same shi positive amma da za a gano shi a ɗora shi a magani. So akwai matsala na rashin number waya na patient yana ba mu wahala.
That urgent need for stability demanded a new approach. Chad realized the solution wasn't a new building, but deploying a community-led strategy to make the clinic's essential services mobile and accessible to everyone. This is Umar, the case worker for Chad International. He knows strong collaboration between volunteers, health workers, and the government agencies is the core of this project.
So this kind of work is not the kind of work that we are doing like one facing alone. Because for this kind of work is work that you are going to with a lot of people so that you can go hand in hand. So that one person lead another person. If there is problem, so one person is correct, there is problem. So if you have a lot of people that are doing this problem, maybe one person that have problem, if maybe someone call him and tell him he is not around, he will let you know there's one person there, go and collect his sample and take to the lab. If he's positive, just call him and go and give him drugs. If it's negative, you are going to give him prevention. That prevention will not allow TB to affect him again.
Umar's integrated approach relies heavily on dedicated community volunteers. Yet, this essential work is fighting a global shortfall. Tuberculosis funding is chronically low worldwide, meaning basic logistics, fuel, maintenance, and transport were never funded at the local level.
Like Saber, we get money for this month, last month. So we're planning for the next month. Let's say you get 50,000. So you remove 25,000 for the next month. You calculate the place where you are going to the place, where you are not going. Let's say we are going to Deba now. How much is going to Deba? Let's say 115. That is 3,000. 3,000 times 30. 90. So let's say you skip this like in 5 days within that month. Maybe within that, when you remove that 3,000 province, 5 or times 10, that is 15,000. You take a food with that remaining change. This work is destructive, you know. The chart is because the chart is performing work. Always they are performers. They are going inside this small village, man. Even their village there is not more than 2 houses. The chart went there and asked them, is there anyone person that having this problem? Is feeling cough or headache in the night?
This dedication is the very reason why patients like the 3 you are about to meet are recovering today.
Ina yawan jin zazzabi, ina yawan ciwon kai, kullum ina zazzabi, ina yawan yin tari, na tashi tarin ma kamar wata rana. Na yi asibiti, na yi medical, na yi ƙananun asibiti har Zambo na je ni. To duk sanda na je ni sa ce min ulcer, hawan jini, asthma.
We have 4 cardinal signs of tuberculosis. The first is progressive weight loss. The second is chronic cough for more than 2 weeks or 2 weeks plus. And then there's fever. There's also drenching night sweat.
Ba zan yi tafiyan 50 meter ba, zan ji numfashina sosai na huta.
Patients are seeing tangible improvements, and their gratitude is the greatest proof that this system works. Chad proves that local action can close global gaps. But this level of personal commitment is not a suitable model for public health.
Improvement in da na samu daga fara shan magani. Tari da yake damuna da daddare, ba na yi, ya daina, sai dai da sassafe irin na farka kamun sha magani. To yakan yi min amma ba kamar da ba. Tun da zan ji kamar mai asma. Ka gane? Zan yi ta tarin kamar wanda I will not survive na ke. So to yanzu duk wannan ya daina.
Na ji daɗin waɗannan sauƙin sosai, na ji daɗinsa. Da ba abin da mutum zai ce sai godiya ga Allah, kuma Allah ya saka muku da alheri, Allah ya albarka. Allah ya ƙara buɗe, Allah ya ƙara ɗaukaka. Allah ya ce mu.